And then I wanted to add one final thing to this misinformation that was received by the 60-minute audience on May 13, 2018. And that is, there was some discussion from Dr. Lisenby about how memory loss was a side effect, but it was one that was well controlled and no reason for people to be afraid of this treatment because they knew how to control the memory loss, although she admitted there was some for around the time of the treatment being given. But basically this is more misinformation because memory loss is not a side effect of shock treatment. Memory loss is how the treatment works. And you may not remember, but I've been saying through all these physical treatments that psychiatry uses, because they have no known medical disorder that they're treating, it's not surprising that doing something to the body with drugs or shock, various kinds of maneuvers, to a substrate, to the body where there's no known abnormality, why would you be surprised if what it does is to damage something? You have an original problem, but there's no known medical cause. You then do something to the body, you're going to do harm to some part of the body. Just as though if you threw a monkey wrench into your Mercedes-Benz while it's running, do you expect it to run better? No. This is, again, where your common sense and your intelligence is all you need to understand what's going on. So in shock treatment, the electricity causes memory loss, confusion, learning, retention problems, the things that happen when you injure the brain, whether it's through a chemical, through a trauma, through a metabolic disease, through your own bad habits of drinking, let's say, or whatever. Now, because the memory loss and the confusion and the learning disabilities are how it works, you cannot hope to eliminate the side effects unless you eliminate what they are calling the benefit. They're one and the same. That's why over many, many decades, they've tried changing how they give the electricity. They've tried changing the way, how fast the electricity builds up, how much. They've tried whether you give it to one side of the brain or the other, or both sides at the same time. And what always happens is, yes, you can lower the amount of harm done by the electricity if you give less, but then you correspondingly lower what they're looking for, which is a change in the person, which they then define as improvement, but which doesn't last. So the side effects are the treatment. They're not side effects, they are the treatment. And what you're doing with shock treatment is exactly the same as you're doing with all of psychiatry's drugs. You're creating a secondary problem on top of the problem the patient already had. If they had a problem of their emotion, of their mind, of who they are, of their soul, you could say, which doesn't mean it isn't happening in the brain. This is not a religious statement. Of who they are, their character, their personality, their fears, their wishes, their disappointments, a problem in their self-esteem, etc., etc. Those things do not have an identifiable medical substrate. So the second condition that's being created is the medical condition that the doctors are creating. So you have one problem, and now the doctors are giving you an additional problem. All of which should only be done under conditions which psychiatry has never really cared about that much. Conditions in which the patient makes the decision freely with information which allows them to decide whether they want it. Now, of course, I know after decades of these battles, immediately the psychiatrist will jump up and say, but that's abandoning the patient. The very part of them that would make the consent is the part that is disordered. Dr. Coleman wants us to expect a patient to use a disordered brain to make an informed consent. And I understand that people who are in the middle of emotional distress may not be in a very good position to decide what's best for themselves. Yes, that can be true. But that's not good enough, because then you have to ask, well, if you're going to take it away from the patient, who are you going to give it to? And so the answer would be somebody else. Well, here's a big one that I want you to think about. In my opinion, and it's not an opinion that I've only held for a week or two or a year or two. In my opinion, everybody else is worse than the patient. The family will be worse than the patient, and especially the doctors will be worse, because everybody else has other agendas. They may be in better shape in many ways, but they have other agendas. The psychiatrists have a great big one. They want to be doctor knows best because we know, we've been trained. And they have created a terrible track record when we've allowed them to decide. Families may be the most loving, but they can also be the ones with the hardest, strongest feelings of other things, which I don't need to elaborate on. We have to be hard-headed and honest when we look at these things. And I ask you to consider whether the patients, as compromised as they may be, have not created a much better track record of what's worth being afraid of and what isn't than anybody else. If patients are so afraid of shock treatment, maybe that's because there's good reason to be afraid of it. If they're so afraid of being in a mental hospital where other people can do things to you that you don't want, whereas no one else seems to be concerned about it. And I say that the historical track record shows that the patients have a better record of knowing what to say yes to and what not to. And that because psychiatry does no basis in science for diagnosing people, they simply repeat what the symptoms are. Therefore, they're not treating any known disorders. That is all the more reason why they desperately need the feedback of the patients to learn when a treatment is actually helping somebody. And when that happens, psychiatry will be free of so many burdens that it has and then passes along to the rest of us. Thank you very much for coming, and do some thinking about what I've been saying to you. See you next time.